All right, so healthcare, right? I mean,
Yeah.
something we all deal with.
Yeah, it's a pretty big deal.
It is a big deal, and it's kind of a touchy subject for a lot of people.
Definitely.
Let's just jump right into it. Imagine this.
Yeah.
You need an appendectomy.
Okay.
In the UK, that'll set you back like $5,000. But here in the US, $30,000.
Yeah, that's a pretty stark difference.
It's a huge difference. And it's not just appendectomies, it's everything.
Yeah.
So today we're going to do a detailed examination of the arguments for universal healthcare in America.
Sounds good.
We're going to be looking at some research from Wallenmu RCT.
Great.
Yeah. And I think it's important to just acknowledge up front that this is a complex issue.
Definitely.
It's got a lot of moving parts, a lot of different perspectives.
Yeah, there's a lot of history involved too.
Right, exactly.
Yeah.
So we're going to try to unpack it all in a way that's easy to understand.
Yep.
So to kick things off, I think it's helpful to take a look back and understand how the American healthcare system evolved into the, shall we say, the interesting system that it is today.
Yeah, I mean, it didn't just appear overnight.
No, not at all.
It's had a long and winding journey.
It has.
So, pre-1950s, healthcare in the U.S. was mostly a private pay system.
So you paid for what you got.
Exactly. You paid out of pocket for your doctor's visits, your procedures, everything.
Makes sense.
But then World War II happened, and things started to shift.
How so?
Well, with wage freezes during the war, employers couldn't attract workers with higher salaries.
Ah, I see.
So they started offering health insurance as a benefit.
To sweeten the deal.
Exactly. And to encourage this, the government started offering tax breaks for employer-sponsored insurance.
So it became a win-win for everybody.
In a way, yeah. But this seemingly small change had massive ripple effects, really setting the stage for the employer-based system we have today.
And it's been a roller coaster ride ever since.
You could say that again. We've seen numerous attempts at healthcare reform over the years: Truman, Nixon, Clinton, and of course the Affordable Care Act, or Obamacare.
Right, and each one tried something a little different.
They did, but none of them managed to achieve universal healthcare.
Each faced its own set of challenges and roadblocks.
Yeah, powerful lobbies, political gridlock, you name it.
Especially the American Medical Association.
Oh.
They were fiercely opposed to Truman's plan for national health insurance.
Yeah, the AMA has historically been a major force in shaping healthcare policy in this country.
Okay, so let's fast forward to the present day. The research we're looking at, it doesn't mince words. It calls the current state of American healthcare a crisis.
Yeah, and for good reason.
Yeah, and the numbers are pretty startling. We're spending 18% of our GDP on healthcare.
Wow, that's a huge chunk of our economy.
It is. And we're not necessarily getting our money's worth.
Yeah, that's the really concerning part. We spend more than any other developed country, but our health outcomes don't reflect that spending.
Right, it doesn't seem to be translating into better health for Americans.
Not really. Over 30 million people are uninsured.
And then you have medical debt, a huge problem.
Yeah, 42% of Americans are struggling with medical debt. It's a massive burden.
And then you have the preventable deaths, 68,000 every year.
Yeah, those are lives that could have been saved if people had access to the care they needed.
It's really, yeah, those numbers are pretty sobering.
They are. They really highlight the human cost of our healthcare system's shortcomings.
Yeah, it's not just numbers on a page, it's people's lives.
Mm-hmm.
Have you ever felt the impact of these issues yourself or seen it affect someone you know?
Well, I think most of us have in some way, you know. It's a system that affects us all.
It does. And the research really delves into the systemic issues. You know, why are things the way they are?
Yeah.
And it's not just about insurance companies or greedy hospitals.
Yeah.
It's more complicated than that.
It is. One major factor is the sheer inefficiency of the system.
What do you mean?
Well, the research points out that 34%, a third, of all healthcare spending goes towards administrative costs.
That's crazy. A third.
Yeah. Think about all the paperwork, the billing systems, the different insurance plans.
Yeah, it's a lot to keep track of.
It is. And all that bureaucracy, it drives up costs without actually improving people's health.
So it's money that could be going to actual patient care.
Exactly.
So, okay, the current system has problems. We've established that. But what's the alternative? What's the solution?
Well, the research presents a pretty compelling case for universal healthcare.
Okay, now hold on. I know a lot of people hear universal healthcare and they think socialism or government takeover.
Yeah, there are a lot of misconceptions out there.
Yeah. So let's break it down. What exactly does universal healthcare mean and how does it actually work?
Sure. So, at its core, universal healthcare simply means ensuring everyone has access to healthcare, regardless of their income, employment status, or pre-existing conditions.
Okay, that makes sense. But how do you achieve that?
Well, there are a few different models. One is a single-payer system, like in Canada.
Okay.
In that model, the government is the sole payer for healthcare.
So everyone's covered under one big insurance plan.
Essentially, yes. Another model is a multi-payer system, like in Germany.
Okay, how does that work?
In a multi-payer system, you have both public and private insurance providers.
So a mix of government and private.
Right. But everyone is still required to have insurance, either through their employer, a private plan, or a government-provided option.
So there's still universal coverage.
Exactly. And there are hybrid models as well that combine elements of both.
Okay, so lots of different ways to achieve universal health care.
Right. The specific model isn't as important as the underlying principle. Ensuring healthcare is a right, not a privilege.
I like that. Healthcare is a right. But I'm still a little skeptical. Does universal healthcare really work? I mean, doesn't it lead to longer wait times and lower quality care?
Those are common concerns, but the research actually shows that's not the case. Yeah. In fact, many countries with universal health care outperform the U.S. on key health indicators.
Like what? Give me an example.
Well, take infant mortality rates. In the U.S., it's around 5.7 deaths per 1,000 live births.
Okay.
In Canada, with its single-payer system, it's 4.5.
That's a pretty big difference.
It is. And Germany, with its multi-payer system, also has lower infant mortality rates than the U.S.
So it seems like universal healthcare isn't just some pie-in-the-sky idea. It's actually working in other countries.
It is. And they're not just achieving better health outcomes, they're also doing it while spending less.
So they're getting more bang for their buck.
Exactly.
Okay, so let's say for the sake of argument that we could implement universal healthcare in the U.S. Would it actually make a difference in people's lives?
I think it would be transformative.
How so?
Well, first and foremost, it would mean everyone has access to the care they need when they need it.
No more worrying about medical bills or going bankrupt because of an illness.
Exactly. It would also free people up to pursue their dreams and take risks, knowing they're not tied to a job just for the health insurance.
That's a good point. Healthcare shouldn't be a barrier to opportunity.
It shouldn't. And beyond that, the research highlights the broader societal benefits.
Like what?
Well, healthier people are more productive, so there's an economic benefit.
Makes sense.
And when people don't have to worry about healthcare costs, they're less stressed, which has positive ripple effects on families and communities.
So it's not just about individual health, it's about a healthier society overall.
Exactly.
Okay, I'm starting to see the bigger picture here. But let's be realistic. Implementing universal health care in the U.S. would be a massive undertaking.
It would.
There would be challenges, costs, and probably a lot of pushback. So how do we even begin to tackle something this big?
Well, the research suggests a phased approach.
Yeah.
First, you need to build a strong foundation. That means enacting the necessary legislation, establishing regulatory bodies, and investing in a robust technological infrastructure.
So laying the groundwork.
Exactly. Then you move into an initial implementation phase. This might involve expanding coverage to specific groups or services, like expanding Medicare or Medicaid.
Okay, so kind of testing the waters and gradually expanding coverage.
Right. And finally, you reach full implementation where everyone is covered and the system is continually monitored and improved.
Sounds like a logical approach, but I'm sure there are a lot of details to work out.
There are, and the research addresses some of the common concerns.
Like what? What are people worried about?
Well, cost is a big one. How do you pay for universal health care?
Right, that's a valid question.
The research explores different funding models, like adjusting tax structures, redirecting existing healthcare spending, and even implementing new taxes.
So it's about finding the right mix of funding mechanisms that work for our country.
Exactly.
What about wait times? That seems to be a big concern for a lot of people.
Yeah, but the research points out that other countries have successfully managed wait times by prioritizing urgent cases, implementing efficient scheduling systems, and ensuring an adequate network of providers.
So it's about having a well-managed system, not just accepting longer waits.
Right.
Okay, and what about choice? Would people still be able to choose their doctors under a universal healthcare system?
That's an important consideration. And the research emphasizes that universal healthcare can preserve choice by allowing patients to select from a network of participating providers.
So you wouldn't be forced to see a specific doctor?
No, the goal is to ensure everyone has access to quality care, regardless of their income or background. while also respecting patient choice.
Okay, this is starting to paint a very different picture of what healthcare could look like in America. But let's be honest, there's going to be a lot of resistance to change.
Oh, absolutely.
So how do we overcome that resistance and actually make universal healthcare a reality?
Well, it starts with education and awareness. We need to dispel the myths and misconceptions surrounding universal healthcare.
Right, get the facts out there.
Exactly. And then we need to build a broad coalition of support.
Like a movement.
Yeah, a movement of people from all walks of life who understand the benefits of universal healthcare and are willing to fight for it.
Okay, so it's about educating, organizing, and advocating for change. But what can individuals do? What can our listeners do to get involved?
Well, I think the first step is to really educate yourself on the issue.
Yeah, knowledge is power, right?
Exactly. Read articles, watch documentaries, talk to people who have experience with different healthcare systems.
So do your homework. Don't just rely on sound bites and social media posts.
Right. Once you have a good understanding of the issue, you can start having conversations with your friends and family.
Yeah, share what you've learned.
Yeah. You might be surprised how many people are open to the idea of universal healthcare once they understand how it actually works.
And it's not about trying to convince everyone you're right.
No, it's about having a respectful dialogue, sharing information, and listening to different perspectives.
Right. So education and conversation are key. But what about taking action? How do we move beyond talk and actually make a difference?
Well, one of the most powerful things you can do is vote. Support candidates who are committed to healthcare reform.
Yeah, make your voice heard at the ballot box.
Exactly. And you can contact your elected officials.
Write to them, call them, show up at town hall meetings.
Right. Let them know that healthcare is a top priority for you.
So it's about holding our leaders accountable.
It is. And you can also get involved with organizations that are working to promote universal healthcare.
There are groups out there doing amazing work.
There are. They need volunteers, they need donations, they need people to spread the word.
So find a group that aligns with your values and get involved.
Exactly.
You know, it's easy to feel overwhelmed by the complexity of the healthcare system.
I know what you mean.
It's a huge issue, and it can feel like one person can't make a difference.
But that's not true.
It's not.
No. Every voice matters. Every action, no matter how small, contributes to the movement for change.
So don't underestimate your own power.
Exactly. Change happens when people come together and demand it, and we're seeing that happening right now.
Yeah, there's definitely a growing movement for healthcare reform.
There is. And the more people who join that movement, the stronger it will become.
So let's keep the conversation going. Let's keep pushing for a healthcare system that works for everyone.
A system that prioritizes health and well-being over profit.
Exactly. So if you're listening to this and you're feeling inspired, take action, do something.
Yeah, even if it's just talking to a friend or sharing an article on social media, every little bit helps.
All right, so that wraps up our detailed examination of universal healthcare in America.
It's been a great discussion.
It has. We've covered a lot of ground. We've looked at the history of the American healthcare system, the challenges we're facing, the potential benefits of universal healthcare, and the steps we can take to make it a reality.
We've explored different perspectives and hopefully provided some food for thought.
Absolutely. And we encourage you to continue the conversation. Talk to your friends, your family, your elected officials. Let's keep the momentum going.
Let's build a future where everyone has access to the healthcare they need.
A healthier, more just future for all Americans. Thanks for joining us.